I decided to join the nurse residency program here at Dartmouth-Hitchcock because doing my clinical rotations here, I just had such great experiences with each unit that I was on. The nurses were great, the doctors were great, just every member that I met was awesome, and I just could really see myself working here.
What impressed me the most the first time I visited Dartmouth-Hitchcock was the talent and knowledge of the staff.
We cater the training toward what you actually need.
What was appealing about the nurse residency program is that it was a guided and structured introductory to nursing versus just starting out as a new grad on my own with no structure at all.
And so our new grads get such an exposure to disease processes and the science of nursing and how to, really follow patients in their disease progression and learn from it.
I moved here originally with the intention that I would stay for a year and see how I liked it. And now 3.5 years later, I'm clearly very happy here.
The whole building in general, when I drove in, it's just such a beautiful campus, and it kind of just takes your breath away at first because you're like, oh, wow.
And it kind of screams welcome, and it's bright. I think it gives this feeling of it's a community and everyone's sort of here to get better, but also here to work together, and I really liked that.
The culture in the nurse residency program is really all about caring and all about you as a new grad nurse.
Although we are individual nurses, we really all are one team here. And when we work during the day, if someone needs something, someone's always there to lend a helping hand.
The teamwork has really been incredible and spoken to the organization as a whole.
The participants have a very collaborative group. They're very supportive and they're growth oriented.
It's a small cohort of new grads. They're all in the same boat, and so they're learning at the same pace. And so, there's a lot of solidarity and cohesiveness, and they do have some fun in their classes.
I felt like it was very easy for me to ask questions and ask for help and not feel as though I was being judged for a lack of clinical skills or knowledge.
Everyone you meet is super kind, and I think that really impressed me. And everyone's very open and welcoming, and they definitely want you to be here.
Dartmouth-Hitchcock offers lots of support in growth, both internally and externally. We have a robust tuition reimbursement program, which allows you to take an accredited degree program if you want to continue on to get your bachelor's, your master's, or your doctorate.
And I actually was just accepted into graduate school for nursing, and I could not have done that without Dartmouth and everything they've taught me.
I learn something new every single day, and that's 3.5 years in.
I just felt like this one was a true teaching hospital.
And I think I wouldn't have been so confident taking on new roles or taking on new responsibilities and participating in committees or getting my master's had I not had that foundation of support and encouragement.
What's impressed me the most about being a nurse here at Dartmouth-Hitchcock Health is the number of opportunities that we have here.
All the staff members, if they thought this was a good learning opportunity on different units, they would really pull you in and they would make it a priority for them to, get the best learning you can while you're here. So that's what I really kind of separated Dartmouth from the other residency programs.
I would absolutely recommend Dartmouth-Hitchcock's nurse residency program to other new grad nurses.
The patient populations that we see, our level of acuity, and the opportunities that come from having one of the sickest populations in the Northeast is that you can grow and develop as a particularly skilled critical care nurse.
Everything that you would be interested in, we can offer it to you, and we have all the support that you will need.